Hi everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Well, today our topic is about macular degeneration, the treatment. We're going to talk about the treatment of for macular degeneration. When we talk about the treatment, it's actually mainly talking about in the modern medicines, Western medicines. Okay, we're not talking about Chinese medicine in this live video. So I want to tell you that there's no cure is available for macular degeneration. It's pretty sad, isn't it? But not really. Okay, if you keep going, keep watching this live video, and I'm going to explain what actually can help you. Right? So your doctor can recommend option to slow the progression of the disease because there's no cure, but we want to slow it down to because it's progressively getting worse and worse and worse, and then you get blind. Right? But that's something that you can do, which is acupuncture and acupressure point. Right? We show you acupressure point to prevent it, avoid it get worse, right? And actually, apart from prevention of it getting worse, you can actually reverse it in some cases. Let's talk about treatment for dry macular degeneration. Well, you know, there's two different macular degeneration. There's dry one and wet one. If you suffer from the dry one, that's just not fun at all, because if you have dry macular degeneration, your doctor may suggest that you work with a low version rehabilitation specialist. The specialist can teach you how to adjust and cope with version loss. Basically, there's no treatment. Right? If you suffer from dry one, there's no treatment for you. Right? So your doctor may also recommend surgery to help improve your vision. I don't see people go with this much. Why is that? Because during the surgery, they will implant a telescopic lens on your eye, which magnifies your field of vision. You know, not everyone's successful with that. Right? Of course, the cost as well. You have to consider about the cost. And basically, what I see in my clinic with dry macular degeneration, with the dry one, they come for acupuncture, and they say, well, the specialist told them that there's nothing they can do. You know, just keep an eye on it. They don't even suggest a low version rehabilitation specialist. Why is that? Because nothing they can do in some cases when it comes to dry macular degeneration. Well, what about wet one? Yes, the wet macular degeneration, they definitely have something to offer. With the dry one, what is the best thing for it? Come to acupuncture. I show you on the last live video how to do the acupressure point. It's something you can do. And acupuncture work better than anything. Right? Even the wet one. Right? A treatment for wet macular degeneration. If you have wet macular degeneration, you will also benefit from working with a low version rehabilitation specialist. Also, your doctor may administer a medication directly into your eye to stop the growth of new blood vessels. It can take several weeks of treatment before you notice a difference, which is an injection into your eyes. Okay, it's painful, right? It's painful. It's not fun. And when you have injection, you can't drive yourself. You have to get someone to pick you up, to drop you, and in the next few weeks, several weeks, and you may not function properly, see well, and then you start to feel, oh, a bit better. It seems a bit better, and then you weigh off again, weigh off again. And for the weight one, you have to have 6 treatment up to 9 or 10 treatment a year. So that's quite a lot, though. That's quite a lot. So another treatment option is they call it photodynamic therapy. So your doctor inject medication into a vein in one of your arms, right? And then use a special laser to close up leaking blood vessels. So this type of therapy can improve your vision, but you may need multiple treatments. Wow. So there's another called photocoagulation. It's another therapy for wet macular degeneration. This involves the use of high energy laser beams to destroy abnormal blood vessels. So the purpose of this therapy is to stop bleeding and reduce further damage to your macula. So however, the laser can cause scarring and leave a blind spot on your eye. Even if this treatment is successful, abnormal blood vessels can regrow, and you will have to return for another treatment. So what it means for this, there's no guarantee, to be honest. And for photocoagulations or photodynamic, one is injection things, drugs into your veins in your arm, the other one's directly in there. Both of them actually try to stop the vein, the blood going to the vein, stop the new growth veins, but it can scar you because of the laser treatment, and you can't prevent that there's other new growth coming out. Therefore they need to keep you treatment, and it's painful. It's painful. And for the weight one, to be honest, they have solution. That's what I just mentioned. But for the white one, there's no solution, basically. Then what can you do apart from this? For the weight one, with the medication, injection, there are a lot of side effects as well. So you need to consider about the side effects. Now, acupuncture and Chinese medicine and self-acupressure point would be able to help you. And what? Diet, eating well, change your diet, sleeping well, managing your emotional, those will help. So we are the only acupuncture clinic in New Zealand to help to use acupuncture to help macular degeneration, whether it's dry one or wet one. So call us if you're in New Zealand. Our phone number is 078467956. 078467956, and you'll be able to find our phone number on the top or on the bottom. All right. Stay awesome. I'll see you next time. Bye bye.